If you've been struggling with leg cramps, weakness, or that constant worry about falling, you're not alone. I'm Dr. John DeMarco, and in my 15 years of practice, I've seen thousands of seniors whose lives have been transformed by understanding the complete picture of leg health. Today, we're diving deep into the ultimate guide to magnesium for seniors. Not just any magnesium. We're talking about the specific types, proper dosages, and how to maximize your body's ability to actually use this critical mineral that could be the missing piece in your leg strength puzzle. But here's what I need you to understand. While many videos focus on just listing supplements, I'm going to show you the scientific mechanisms behind why magnesium works, which forms your aging body absorbs best, and how to avoid the costly mistakes that leave many seniors disappointed with their results. Let me share something that might surprise you. Margaret, a 72-year-old patient of mine, had been suffering from painful leg cramps for 3 years. Her doctor told her to take magnesium, but after months of the wrong type, nothing changed. When she finally came to see me, we made one simple switch in her magnesium form, and within 2 weeks, her cramps disappeared completely. The truth is, not all magnesium is created equal, and your body's ability to absorb and use it changes dramatically as you age. By the end of this video, you'll know exactly which type is right for your specific needs, the precise dosages that work for seniors, and how to combine it with other nutrients for maximum effectiveness. Let's start with what's really happening in your body. After age 60, your intestinal absorption of magnesium decreases by up to 30. At the same time, your kidneys begin excreting more magnesium, and many common medications like proton pump inhibitors and diuretics actually deplete your magnesium stores further. This creates what I call the magnesium paradox. The older you get, the more you need it, but the less your body can actually use it. According to a 2021 study published in the Journal of American Geriatrics, over 60 of seniors are magnesium deficient, yet most don't realize it because the symptoms mimic normal aging. Magnesium is involved in over 600 enzymatic reactions in your body. For your legs specifically, it's essential for muscle contraction and relaxation, nerve signal transmission, and maintaining proper electrolyte balance. Without adequate magnesium, your muscles can't fully relax, leading to those painful cramps, especially at night. Now, here's where most people go wrong. They assume any magnesium supplement will work. But different forms of magnesium have dramatically different absorption rates and target different issues. Let me break down the most important types for seniors. First, Magnesium Citrate. This is bound to citric acid, which significantly enhances absorption. Research from the American Journal of Clinical Nutrition shows citrate form has about 30 better bioavailability than magnesium oxide. It's particularly effective for digestive issues and general magnesium deficiency. If you're dealing with both leg cramps and occasional constipation, citrate is often your best choice. For seniors, I typically recommend 150 to 200 milligrams twice daily with meals. The citrate form also supports your metabolism because citric acid plays a key role in cellular energy production. Next, Magnesium Glycinate. This form is bound to the amino acid glycine, which has natural calming properties. A 2019 study in the Journal of Sleep Research found that glycinate significantly improved sleep quality in seniors while reducing muscle tension. If your leg cramps are worse at night or you're having trouble sleeping, glycinate is ideal. The glycine component actually helps the magnesium cross into your cells more efficiently and doesn't cause the digestive upset that some other forms can trigger. I recommend 200 to 400 milligrams about an hour before bedtime. For cognitive support, there's magnesium L-threonate. This newer form was developed specifically to cross the blood-brain barrier. While primarily studied for brain health, It also supports the nerve signals that control muscle function. The recommended dose is typically 144 milligrams daily, taken in split doses. Now, let's talk about what to avoid. Magnesium oxide is the cheapest and most common form, but it has only about 4 absorption rate. A study from the European Journal of Clinical Nutrition found that seniors taking oxide experienced minimal improvement in magnesium status compared to other forms. Here's your dosage strategy. The National Institutes of Health recommends 420 milligrams daily for men over 51 and 320 milligrams for women over 51. However, I've found that seniors often need slightly higher amounts due to reduced absorption. My approach is to start with 200 milligrams twice daily with meals, using either citrate or glycinate depending on your primary concern. If you're not seeing improvements in 23 weeks, we can increase to 300 milligrams twice daily. But here's something critical: timing matters enormously. Take magnesium with meals to enhance absorption and reduce the risk of digestive upset. If you're taking calcium supplements, separate them by at least 2 hours because they compete for absorption. Let me address the elephant in the room: safety. Magnesium toxicity is rare from supplements, but it can occur especially if you have kidney problems. The upper limit for supplemental magnesium is 350 milligrams daily, though this doesn't include magnesium from food sources. Watch for early signs of too much magnesium: diarrhea, nausea, or muscle weakness. If you experience these, reduce your dose. And always consult your doctor before starting any new supplement, especially if you're taking medications for heart conditions or blood pressure. Now, here's how to maximize your magnesium absorption. First, ensure you're getting adequate vitamin D. Research shows that vitamin D deficiency impairs magnesium absorption. Most seniors need 2,000 to 4,000 IU of D3 daily. Second, include magnesium-rich foods in your diet. While supplements are often necessary, food sources provide cofactors that enhance absorption. Spinach, almonds, black beans, and avocados are excellent choices. 1 cup of cooked spinach provides about 157 milligrams of highly absorbable magnesium. Third, manage stress. Chronic stress depletes magnesium rapidly. The stress hormone cortisol actually increases magnesium excretion through your kidneys. This is why stress management, whether through meditation, gentle exercise, or adequate sleep, is crucial for maintaining magnesium status. Let's talk about drug interactions you need to know about. Magnesium can enhance the effects of blood pressure medications, potentially causing blood pressure to drop too low. It can also interfere with certain antibiotics and should be taken at least 2 hours apart from medications like tetracycline. If you're taking proton pump inhibitors for acid reflux, you're at especially high risk for magnesium deficiency. These medications significantly impair magnesium absorption, and many seniors on long-term PPI therapy develop severe deficiency without realizing it. Here's a practical approach I use with my patients. Start with a high-quality magnesium glycinate supplement, 100 milligrams with dinner. This helps with both leg cramps and sleep quality. After 2 weeks, assess how you're feeling. If leg cramps persist, add 150 milligrams of magnesium citrate with breakfast. Keep a simple log of your symptoms: leg cramps, sleep quality, energy levels, and muscle tension. This helps you track whether the magnesium is working and whether you need to adjust your dosage. Now, let's address some common questions I hear from patients. Can I get enough magnesium from food alone? Unfortunately, probably not. Modern agricultural practices have depleted soil magnesium levels, and many foods that were once rich sources now contain significantly less. Plus, the absorption challenges that come with aging make it difficult to maintain optimal levels through diet alone. What about topical magnesium? While Epsom salt baths can be relaxing, there's limited evidence that significant amounts of magnesium are absorbed through the skin. However, many patients find topical magnesium helpful for localized muscle tension. Should I take magnesium if I have kidney disease? This is absolutely a question for your doctor. Kidney disease impairs magnesium excretion, so supplementation could be dangerous without medical supervision. Here's something important to understand about testing. Standard blood tests for magnesium aren't very accurate because most magnesium is stored in your bones and muscles, not your blood. Your doctor might order a red blood cell magnesium test, which is more accurate, or they might assess your magnesium status based on your symptoms and medical history. Let me share another patient story. Robert, age 68, came to me with severe nighttime leg cramps that were disrupting his sleep. His wife was concerned because he'd wake up crying in pain. His doctor had prescribed muscle relaxants, but they made him groggy during the day. We started him on 200 milligrams of magnesium glycinate before bed, along with improving his overall mineral balance. Within 3 weeks, his cramps decreased by 80, and his sleep quality improved dramatically. 6 months later, he's completely cramp-free and has more energy than he's had in years. The key was understanding that his leg cramps weren't just a muscle problem. They were a sign of disrupted cellular metabolism that magnesium deficiency was causing throughout his body. Here's what I want you to take away from this. Magnesium deficiency is incredibly common in seniors, but it's also very treatable. The key is choosing the right form for your needs and taking it consistently at the proper dosage. If you're dealing with leg cramps and digestive issues, start with magnesium citrate. If sleep and muscle tension are your main concerns, choose glycinate. And remember, it takes time. Give any magnesium supplement at least 46 weeks to show full effects. I always tell my patients that magnesium is like a foundation stone for healthy aging. When it's solid, everything else, your energy, sleep, muscle function, and even your mood improves. When it's missing, multiple systems start to break down. Your action step for today is simple. Schedule a conversation with your healthcare provider about magnesium supplementation. Take this video's information with you. Ask about testing your magnesium status and which form might be best for your specific health situation. Remember, you don't have to accept leg cramps, poor sleep, or muscle weakness as inevitable parts of aging. With the right approach to magnesium supplementation, many seniors experience dramatic improvements in their quality of life. If this information has been helpful, I'd love to hear about your experience with magnesium in the comments below. And if you know another senior who's struggling with leg cramps or muscle weakness, please share this video with them. You'll find links to the research studies I mentioned today in the description below, along with my recommendations for high-quality magnesium supplements. Remember, your health is worth the investment in understanding it properly. Until next time, this is Dr. John DeMarco, reminding you that taking control of your health is always the right choice, no matter what age you are.